In this picture, there is a space between the maxillary central incisor and mandibular central incisor. So, this is the example of black triangle. So, let's see about black triangle. Black triangle is also known as loss of interdental papilla. So, loss of interdental papilla is called as black triangle. So, recession of gingival tissue from the interproximal areas leaving behind a space can be termed as loss of interdental papilla. So, there is a space created between the interproximal area because of the recession of gingival tissue. This is called as loss of interdental papilla or black triangle. So, mainly it is due to the recession of gingival tissue. So, what are the causes for this condition? First one is tooth extraction, and second one is excessive surgical periodontal treatment, and the third one is localized progressive gingival and periodontal lesion. So, tooth extraction and excessive surgical and periodontal treatment, localized progressive gingival and periodontal lesion are the causes for black triangle. So, next moving on to Nordland and Turnow classification of interdental papilla. So, the first picture is normal and the second picture is class 1. There is a interproximal contact point and interproximal CEJ. Between there is a 1/3 portion is lost. So, this is class 1, and class 2 is there is a complete gap between the interdental contact point and interproximal CEJ. And the fourth one is class 3. There is complete loss of interdental proximal gingiva and there is a gingival recession extend beyond the cervical portion of the tooth. This is class 3. So, class 1 is class 1 and class 2 and class 3. So, what are the effect of loss of interdental papilla? First one is phonetic problem, and the second one is lateral food impaction, because of there is a space present, so food is impacted between the tooth. And third one is lead to cosmetic problem. It is very important because the space resembled as a black color spot. Next, moving on to methods to create interdental papilla. How will you create interdental papilla? There is two methods for this. One is non-surgical method and another one is surgical method. The non-surgical method is orthodontic forced eruption, and the second one is if dental papilla is absent because of diastema, we have to do orthodontic closure is the treatment of choice. And the third one is repeated scaling, root planing and curettage procedure. These are the non-surgical methods to create interdental papilla. And the next one is surgical methods. The first one is pedicle graft technique, and the second one is semilunar coronally reposition papilla using free connective tissue graft. So, these are the surgical method for correcting black triangle.